All cancers have a hereditary component, and it averages around 10% of all cancers. And what that means is the person has inherited a genetic mutation or an alteration in their DNA, and then that genetic mutation increases their predisposition to developing specific cancers depending on what gene is mutated. The major designation that I have for what I do is something called the Advanced Practice Nurse in Genetics. One of the things that I do is explain to people the purpose of a genetic evaluation and genetic testing is to find out if you're at increased risk so we can make recommendations to you to A, prevent your cancer, actually prevent a cancer from occurring, or to at least find it as early as possible. The earlier we see a patient, the better, because a genetic test generally takes 2 to 4 weeks to get the results. So if a woman is using this information to make a surgical decision about how she's going to treat her breast cancer, basically you want to get that test started as soon as possible. Giving a relative a good family history is one of the greatest gifts that you can give your family, because that is a tool to assess the risk for so many different diseases. So my assistant actually works with patients before I see them to try to get them to think about their family history, talk to other family members, get that all written down before they actually come in for the appointment, so that when we get to the appointment, the assessment of their risk can be much more accurate. So after we do that, then I start explaining to the patient the differences between the hereditary form of cancer and the more common sporadic or acquired type of cancer. And then if there is enough risk to warrant a genetic test, we start talking about the actual testing kind of as the final part of the consultation. The results disclosure visit is as important as the initial consultation. I go over the actual genetic test, if there's any mutations or any genetic variants that have been identified by the laboratory, and then what that means for their future medical management. If a patient does test positive on a germline genetic test, then any first-degree relative has a 1 in 2 chance of having that same mutation. Because this is DNA testing, the test result doesn't just affect you, it affects your entire family. And the closer the person is to you, siblings, children, parents, those people have a higher risk than the more distant relative. Breast cancer is the most common cancer women get. Prostate cancer for men. These are very common cancers, but at best, 10 to 15% is due to an inherited mutation. So even though we test a fair number of our cancer patients, the test is a part of the picture, but it's not the whole picture. So a negative genetic test always needs to be interpreted with the personal and family history of the patient. 2 big myths about genetic testing is it's very, very expensive and it's going to hurt your chances to get health care. Those are 2 major myths for genetics, and they're both myths. They're not true. What I would like to say about our team is that we are a team. We really work together. It's really good to be on the same floor so we can run into one another's offices, which we do all the time. We're constantly going from one office to the other office about a part of the patient's care. I think it's just mainly our ability to respect one another as colleagues and communicate.